After more than a year since it started, the city of Belleville in Ontario remains under a state of emergency that's fueled by overdoses connected to the opioid epidemic. The state of emergency is in place despite the Public Health Agency of Canada releasing new data that points to a 13% drop in substance-related deaths in 2024. That's compared to the previous year. Joining us to explain why the drop doesn't mean the crisis is over is Nick Boyce, Policy Director at Canadian Drug Policy Coalition. Nick, good morning.
Good morning, Anne-Marie.
First of all, how has the opioid crisis changed in Belleville in the last year? What's happening there?
Well, first, I want to clarify, we're not dealing with an opioid crisis, we're dealing with an unregulated drug crisis. This is the unregulated nature of the illicit illegal drug supply. It's constantly changing, and despite numbers showing some downward trends, it's right across North America, we still have 7 people dying every single day in Ontario.
What are you seeing in Belleville that looks different than it did the year before?
My understanding is that we have seen a reduction in EMS calls and hospital visits, but we've seen a growing homeless population, and some of the services that have been established are still really not reaching the people they need to reach, and there's been a dispersion of people, so it's getting harder to actually connect with some people.
Was the state of emergency the right call in terms of trying to improve outcomes for the crisis that community is facing?
I think there's a lot the provincial government could have been doing without having to declare a state of emergency. This government has really doubled down on sort of an enforcement and abstinence-based treatment approach. They've not supported harm reduction programs, which are known interventions that reduce EMS calls, significantly reduce deaths. So they could have put in things like supervised consumption sites. They could have put in safer supply and regulated supply. Those are things that they could have been doing. There's no question that better and more accessible treatment is needed, but shouldn't be at the expense of harm reduction programs. They need to work in tandem.
Well, despite the drop in substance-related deaths, you say it doesn't mean that Canada's opioid crisis is over, obviously, but can you explain more of that for us?
Well, again, we have probably about 20 people a day dying across the country. Those numbers are still way higher than they were before COVID. That significantly increased things. Again, we're not addressing the root cause of the problem, which is prohibition and criminalization. We spend significant resources trying to police our way out of this. Scheduling drugs, so we schedule drugs, we try to enforce the laws, and that has not stopped people needing drugs or using drugs or wanting drugs. All that has done is change the supply. And while some of the drugs in the supply right now may be less toxic than some of the other drugs, that can change any minute. And until we regulate the supply of the drugs, we're going to continue seeing these issues. Until we stop wasting police resources and actually putting those into things like housing and effective balanced treatment, this is going to be a thing we're going to be dealing with for a long time.
What do you need more specifically at the policy level to change, whether it is municipal or federal or provincial, or do you need all three?
You need all three. You need all three. Fundamentally, though, it's a federal issue with the Controlled Drugs and Substances Act. That is the act that prohibits many of the drugs. It is the act that causes us to spend, millions, if not billions of dollars on failed law enforcement approaches. It takes money away from investments in housing and treatment. And like I said, it does not regulate the supply of drugs. It causes new and different drugs to emerge all the time. And that's what we've been seeing over the last 10 years. The supply changes, if not on a weekly but monthly basis. We're seeing new drugs out there as a result of prohibition.
Nick Boyce, Policy Director at Canadian Drug Policy Coalition. Thank you.
Thank you.
If you like that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.